right now. All right， 那个王老师，麻烦您也准备一下您的主旨演讲，谢谢。
好的，可以开始。
All right， 那个王老师，麻烦您也准备一下。请中控也静一下音，对，有几位老师可能还没有静音。好，谢谢。尊敬的老师们、同学们、观众朋友们，大家好。
Distinguished guests, ladies and gentlemen, good evening.
没有声音了。
Please unmute.
听得到吗？听不到。听得到吗？
现在可以了。
Yes, we can hear you.
OK， 好，我们接着。正如许多朋友已经熟知的
As we have already known, this training program is under the guidance of Professor Chen Zhu, as well as the Primary Care Foundation, as well as the academician Zhong Nanshan, and is also supported by the China Patient Association, and also guided by the National Health Commission, and as well as the Life Oasis group. And also, this is also supported by the Primary Care Foundation. And this training program faces every physician, healthcare workers, public care workers, as well as medical students or students of related specialty. Since the launch of this program, we have 10,000 of our trainees in this program, and we have completed our first module. In the past week, 12 clinicians as well as public health specialists has brought very insightful courses. I would like to, on behalf of the foundation as well as the supporting groups, we would like to congratulate everyone and thank for the dedication of every specialist taking part in this course. Thank you. We are a Health China 2030 Global Public Health Management Training Seminar. Today, this is our first seminar. We have received a lot of specialists from domestic as well as abroad, and they will all discuss very hot topics and give us very insightful experiences. First of all, this is the first panel is about the treatment and diagnosis of the COVID-19. The second panel would be the global solution to public health priorities. First of all, I would like to introduce the specialists taking part in our seminar today. First, the moderator of the first panel is the chair of the Infectious Disease PKU First Hospital and also member of the National COVID-19 Expert Committee, Professor Wang Guiqiang. And the experts participating in this panel would be Professor Zhang Wenhong, the Director of Infectious Disease Department in Huashan Hospital, the Professor Li Taisheng, the Director of Infectious Disease Department in Peking Medical College Hospital, and also from the Erasmus University, Rotterdam. He's also a world-renowned expert on SARS and H5N1, Professor Outbreaks, also from the Cleveland Clinic, Professor Steve Gordon, Professor Luan Bruno Mercer from Harvard Medical School. And also we have in the second panel, the moderator, Professor Chen Yaolong from the Lanzhou University. Also, the specialists in panel 2 include Professional Wu Shanlian, the Professional of Health Economics in Fudan University, and also Professor Xue Lan from the Tsinghua University. He's the Dean of Schwarzman College. Also, from the Columbia University, Professor Katerina Janus. Welcome all of you here to the seminar today, and we really look forward to your sharing with us. Let's welcome moderator Professor Wang Guiqiang to give us the opening remarks and open our first panel, please. Thank you for introduction. First of all, I'm very pleased, very honored to be here to get together in this panel with my colleagues domestically as well as internationally to participate in this seminar. And we are talking about some of the public as well as clinical issues during the COVID-19. This Global Public Health Management training course is a sharing platform for the experience and some thoughts on the COVID-19 outbreak. We also focus on several issues considering the control and prevention of the outbreak public health crisis. We would like to increase the capacity of primary health workers as well as our colleagues globally, and to increase their knowledge in the clinical treatment as well as prevention to improve our public health management capacity in China. This public health management training program is coherent with the WHO's guidelines as well as the call from the China's government. On the 19th of in April, our first launching event took part, and Academician Zhong as well as the Academician Yan Zhen has participated in that launching event to share some of their experience concerning the COVID-19. Also, on the 2nd and the 7th of April, we have conducted several training courses, includes in the launching event, Professor Academician Chen Zhu, who is also the chairman of the China's Agriculture and Industrial Party, he has encouraged our healthcare workers as well as other health workers to move on to fight the COVID-19 and encourage them to improve their communication as well as collaboration to fight against the COVID-19 epidemic. And today, in our seminar, we have invited with us several of the very renowned infectious disease experts as well as public health experts. We would discuss some of the very hot topics in the COVID-19 as well as in the public health management. We would go very deep in each topic, and hopefully this seminar today would reinforce the public health management, not only in China, but also worldwide, and also to increase the experience sharing clinical-wise. I do hope that this seminar today can bring you some thoughts, and also you can have some take-home messages. Under the guidance of the Chinese government, China has done a lot to contain the COVID-19 epidemic, and we have reached some, and we have some success. But we are still faced with huge crisis. For example, the imported cases as well as asymptomatic patients. We need some systematic efforts to review those things as well as to learn from these things. Also, during this process, the country around the world and also the WHO organization has assisted China in fighting against COVID-19. We, people from China, would definitely brave that in our heart and memorize that. Now, China is still in the fighting of COVID-19 outbreak, and we are in a very critical stage in the containing the outbreak. And at this time, I think it's very high time that we should get together to discuss about how we should collaborate as a global community to fight against the COVID-19 and how do we treat more COVID-19 patients. I do believe that through our collaboration around the globe, the COVID-19 will be contained and we will win the fight. Thank you. So next, we will enter our panel discussion. The first panel today, we have two panels. The first panel is about enhancing the clinical care system for novel infectious disease outbreaks. How do we build the treatment system? And the second panel would regard some of the global solutions to public health priorities. And first of all, as the moderator of the first panel, I would like to introduce Professor Zhang Wenhong, Professor Li Taisheng, Professor Osterbaus, and also Professor Osterbaus is from Amsterdam, also from the United States, Cleveland Clinic, Professor Steve Gordon, and also from the Cambridge Health Alliance, also assistant professor at Harvard Medical School, Professor Lu An Brunemather. Welcome all of you here. to participate in this panel. Welcome. I think the COVID-19 pandemic has brought to us a lot of impact and challenges to all over the world. We understand the control system and prevention system to the COVID-19 outbreak is very crucial. We should establish a system of the prevention and control. And China has accumulated a lot of experience and it discovered several problems. First of all, I would like to get to know about something about currently, how is the COVID-19 status quo in the United States as well as in the Netherlands. We would like to understand about your current situation regarding the COVID-19 epidemic. I would like to invite Professor Osterbaus to introduce something. How is everything going on in Netherlands?
Ab 教授在吗 ？OK， 那么我们有请 Steven。Could you please introduce the COVID-19 in America?
Yes, thank you. Can you hear me?
Yes, sure. Okay. Nice to meet you.
From the United States, first, I want to be very thankful for the invitation and to learn from you all. We truly appreciate the concept that this is a global problem. And there have been a lot of challenges and opportunities. Where I am in the middle of the United States, currently with social distancing that occurred with our state, we are probably at a plateau level. And in the Cleveland Clinic healthcare system, I think we learned a lot. And I would emphasize that it's the systemness that actually helped us take on the burden of what we would say the COVID-19 disease process. We were very concerned initially about a potential surge of cases and losing patients with acute lung injury if they didn't have access to ventilators. Fortunately, we were able to kind of digest that process. And now for the past 10 days or so, things have been stable. We are now trying to learn and move into what we would say recovery. I would add that part of our challenge in the United States currently, in a study just actually released this morning, is a lack of access to testing. We believe, and we have learned from others, that actually now moving to testing, tracking, tracing is probably a key to containment and in community spread, household spread. This will be important. And to date, I think it's estimated that we are not testing enough patients and our capacity will need to increase. Thank you.
Yes. Hey, Stephen, thank you for your introduction. How many patients with the COVID-19 showing that severe or critical? What percentage in your hands in your hospital?
In our hospital, that's a good question. So we probably at this point in our system have about 150 patients with COVID-19. The ratios have moved. So I would submit at this point about 60 or 70% of our patients are now out of the intensive care unit. The one lesson that we have learned is, and this is the European experience, and I think the China experience, good supportive care is the really only proven therapy for people with the acute lung injury. And that has been a marvelous thing to watch as we've learned from you in terms of how to deliver intensive care in a safe method to try to mitigate exposure, and proning, other types of things that our intensivists are doing, and team-based rounding has truly changing the way we deliver healthcare. And we thank you for that.
Yes, in our experience, that in the early stage, is so many patients come up. So they are very crowded in the hospital healthcare system. So this is a good way is to stratify the mild, moderate, and severe critical cases. It's divided in different healthcare system. So this is the key point to get in the reduction in mortality. So how the system works in your hospital healthcare system?
So in our healthcare system, what we also have done is probably moving toward what we call universal testing of patients coming in. I'm very humble about this disease. I do not know all the clinical presentations of COVID-19.
Mhm.
And although we're all focused on the fever, the cough, as you have taught us, there are other presentations, the anosmia, the diarrhea. And so we don't know all the clinical presentations of COVID-19. So I think the first part is obviously to make sure that you have adequate testing for patients coming in. Then, of course, any patient with acute respiratory distress or high risk will be monitored. We have done what you all have done as well, in terms of increase our intensive care unit capacity. Monitoring, very important. I must say, in our treatment, we have become more parsimonious. We are now only treating patients on controlled trials. So we have pulled back from the initial, I would say, enthusiasm of maybe Kaletra and hydroxychloroquine with azithromycin, and now are enrolling people with trials, including remdesivir. And we have not yet used, although looking at the convalescent plasma, but there's, as you know, a lot of therapies out there, including IL-6,
Yeah.
IL-1 inhibitors. And so we're trying to make sure that patients are enrolled in trials so we can learn from that.
Okay, thank you very much. It's where it seems that it makes sense to make the patients get good health care. Okay, Lo Ann, are you there? Lo Ann, yes. Hi, nice to meet you, Lo Ann. It's my name English name is John. It's can you share some experience in your hospital health system?
Yes, I am at a community-based academic teaching organization. We have two hospitals just outside of Boston, one in the town of Cambridge and one in the town of Everett. And we have a very large primary care practice, multiple clinics throughout the northern suburbs of the Boston area. And we are in our third week of surge. We surged before all the academic teaching hospitals did in Boston. Boston just entered their surge in the past couple of days, and we have been living it for our third week. And it's primarily because of the patient population we serve. We serve a safety net population, and we have patients coming to us from the largest communities that have been primarily affected by COVID-19. These are towns like Chelsea, you may have heard it on the news, Chelsea, Revere, and Everett. So we've been hit early and we've been hit hard. We still have capacity. We've had some major challenges. Dr. Gordon already referenced testing. So we've had access to testing, but the biggest challenge for us is the turnaround time. So we have blown through a lot of personal protective equipment early on. And that's been my biggest challenge, is access to personal protective equipment. Respirators, primarily N95 respirators, and isolation gowns. And we've actually adopted UV disinfection to reuse our N95 respirators. And we've actually gone to using vaporous hydrogen peroxide to sterilize isolation gowns to put them back into use. In addition to that, we rolled out Tyvek suits to all our medical critical care in our surge PACU areas so that we would decrease the burn rate on our isolation gowns. So those have been our major challenges. I think from an organizational perspective, we feel like we're in a better place because we've been doing it for a couple of weeks and people have adjusted, our teams have adjusted for providing excellent care. And like Dr. Gordon referenced, we're learning. And early on, people were intubated probably too soon because they wanted to control the airway, but we've come to learn that high flow oxygen keeps patients out of the ICU and gets them home sooner.
Yeah. In the early stage in Wuhan, there are many patients there, so the hospital healthcare system couldn't be used for severe and critical one. How to deal with the mild, moderate patients in your hands? Do you have the temporary hospital, these like things?
So we have, in our ambulatory care setting, we have set up a respiratory care clinic for patients. And we are trying to keep patients with mild to moderate disease out of the hospital. And we are trying to manage them, many of them at home with supplemental oxygen. So that has decreased the pressure on our emergency departments. And I think we're keeping patients out of the hospital. in terms of treatment, like I said, it's really supportive care. We have also abandoned the use of a lot of empiric therapy. We are no longer using hydroxychloroquine. We've encountered some toxicity issues. And we're a safety net organization, so it's been really hard to enroll in clinical trials, but we do have access. We're just in the process of getting access to expanded compassionate use for remdesivir, so we're excited about that.
Yeah.
And we have a couple other trials we're working on, but it's been a challenge as a safety net organization, even though it's my population that's been disproportionately impacted by this disease.
Yeah, yes. It's a the home is a way to get the healthcare system can be used for the severe critical one. It's a good idea, but in China, in Wuhan cities, in the early stage, we take the similar strategy to isolate the mild and moderate patient at home, but we found that there are many cluster spreading of the COVID-19. So it should be awareness that stay at home, isolation at home is kind of the risk of the spreading. So there are many cluster spreading cases in the Wuhan family spreading, especially in community levels. So my recommendation that is best way to get the special hospital or cabinet hospital, temporary hospital can be make the situation good. So I think it's take risk to get this spreading of disease. Okay, thank you very much. Thank you. We'll discuss later. Okay, Wenhong, are you there? Wenhong?
Hey.
Okay.
Yes. Yeah.
Can you give some recommendations, comment for the control of this COVID-19 in Chinese or English? Okay.
Sorry, pardon. Please say again. I'm not here very clearly.
OK， 你就介绍你的一些经验和体会吧，向各位，就是上海的经验和体会。
好的，yes, in Shanghai, actually, we control the epidemic of the disease in very early stage, and so at a very early stage, we do the detection for every suspected patients, and majorly our CDC staff were tracing. We do tracing very good, and they will found every close contacts and give the quarantine. So therefore, even Shanghai, we are a bigger city with 30 million people population. However, we control every suspected cases imported from Wuhan, the epicenter of China, in the very early stage. Then we found all the close contacts. So we give the quarantine. So after the only 1 month, the shutdown of the city, actually we found every suspected case, and the next generation patients are not so many. So therefore, the total cases in our local community, so not so many. So therefore, in Shanghai, we only have several hundred and less than 400 cases together. So no overwhelming patients happened in our city. So this kind of the situation is really different from that in Wuhan city. However, recently we are on the second wave of the imported cases from other countries. Now recently we have almost the other 300 to 400 patients here. However, at this wave, we started to control the progression of the disease. We want to stop the progression of the disease at a very early stage from a mild and the moderate. We want to stop the progression from the mild to the severe. So therefore, I think the support, the oxygen support therapy and the nutritional support is very important. And at a very early stage, we will use the indicators of some coagulation related indicators like just like a D-dimer and if fibrinogen and FTP, I think these indicators will give us some predictor for the progression of the disease. So therefore, we will give the treatment just like anticoagulation therapy. And sometime we will, once we found there's a progression of the disease in the CT scan and with high inflammatory level, we will give the short duration with low dosage steroid. So therefore, at our second wave, we found that so we can use anti-inflammatory treatment and we can use anticoagulatory treatment and give enough nutritional treatment, keep the albumin level at the very at the satisfactory range. We found the progression rate from mild or moderate to the severe case or critical illness status is the ratio is very low. So at our second stage, just recently, we found that we are not so many people that we need to use so invasive mechanical ventilate. So only one patient from the 300 cases in all my patients recently in our stage, we found that we can stop the progression and only one case that needed to use a mechanical invasive ventilator. So therefore, I think if we have a lot of patients, the most important for us is not to save the critical ill patients because we do not have so many ICU beds. So the most important, I think, is for us is to stop the progression of the disease. So this is our experience in current situation. However, I think if we have a lot of critical ill patients, I think we should provide enough ICU beds. So the overwhelming patients in our city, I think it will be a great burden for us. Actually, recently in our Shanghai city, we do not have so many ICU beds like that in New York and also like that in Boston. So I think in that stage, we will prepare for the next peak of the disease in the forthcoming several months. So we will study to learn to prepare the beds of the ICU. We will do more to control the imported cases. I think this is what we have learned from the other countries. Thank you.
Okay, thank you, Wen Hong. Is Professor Li Taisheng are you here? Is Professor Li is still in Wuhan? Is as a national health expertise group. Can you give some introduction of experience in Wuhan, especially in the severe case and the critical case therapy?
Okay, so I came to Wuhan in 7 February, and now working more than 2 months, and with our hospital, PUMC hospital, we building a temporary ICU unit in Wuhan County and treat the severe and critical patients more than 100. And so according our initial experience, so we up to now we don't find we don't have the enough evidence for the efficacy drug and for treat those patients. So for the serious and critical patients, we must treat them with comprehensive treatment, including nutrition support, oxygen therapy, and anti-inflammation therapy. As mentioned. Also, very important is to anticoagulation therapy, because most of those patients have a hypercoagulation. Our team found for those patients, they have a lower platelet and persist lower lymphocyte count and high level diamond and CRP. So for the doctors, we treat those severe patients or critical patients, but most important is find which biomarker might be predictive as the patient be from the minor phase go to the severe or critical patients, and to treat them early.
Okay.
So, yeah, thank you.
Okay. Thank you, Professor Lee. It's I think it's app, Professor Osterbaus. It's very nice to meet you in Holland.
Yes.
Yeah. It's you are our famous virologist. So can you give some comments on the virological aspect for the COVID-19 the coronavirus? And
let me give.
Okay.
Well, first of all, thank you for the invitation, which I very much appreciate, obviously. And first of all, let me try to give you a brief summary of what's going on in Europe. And I think it's important to realize that Europe is not one country. We have 28 different countries, and the policy implemented in different countries, I think we have 28 different policies. So there is not a universal approach. And I think when we look back to the early days, January, February, we went really from a stage of denial, where in general in Europe we could not believe that really a pandemic was going to come over us, and this resulted basically in measures being relatively mild. And from that situation we went gradually into a more, when we were confronted with the enormous outbreaks that we had, especially in Italy, where they had to go to a complete lockdown, and in Spain, where also is still ongoing. Those are two epicenters. And I should say that there has been a lot of discussion from the beginning what to do with the measures in different countries. So for instance, closing borders, etc., was initially thought to be completely unacceptable, until gradually people in Europe started to realize that we had to do much more than that. And so gradually, indeed, lockdowns were being implemented, but they were again different in different countries. If I take my own country, the Netherlands, there we had what we call an intelligent lockdown, which meant that in principle it was done on the basis of voluntary measures by people. They were being advised to stay at home, those kind of things, and that was initially without any policing measures, etc. And gradually that became more and more severe. And I think that indeed then gradually then we see that in different European countries, quite a number of patients were brought to hospitals. And the situation that you've heard from the US as well, but also from Asia, that basically there were, of course, we had a lot of patients hospitalized. ICU issue was a very big issue in certain countries, whether there was enough ICU facilities. For instance, in Spain, it is a major problem. Also in the country like the Netherlands, it was actually feared that our capacity would not be enough. We have about 1,200 patients at the moment in ICU, and we have about 2,000, a capacity of 2,000, which we increased gradually. So there's a lot. And then basically there's a lot ongoing. Now we are at the situation that the curves are flattening a little bit, although I'm not sure whether people are sufficiently aware about the measures that could be relaxed. Perhaps one thing that's important to mention, and that especially when we're talking to our colleagues in Asia, that for instance in a country like the Netherlands, there's not enough mouth masks for the hospitals and for the care in general, also for the laboratories. So there is a problem there, and people in general are not advised to wear, or are actually being discouraged at the moment to wear mouth masks. Yeah? So there is a problem, but also about the measures. If you look at the different countries, closure of shops, closure of certain shops, or all the shops like in France, there's a lot of diversity and there's a lot of insecurity there for what are the proper measures to be taken. And obviously, one of the major things that is lacking in many countries is sufficient possibilities to do the testing, similar to what we heard from the US as well, testing and tracking and then quarantining the people. That those measures are being implemented, but to some extent in certain countries, more on a voluntary basis than on a more generic basis. So we see that in certain countries now that the R0 is going down. In some countries, we think it's even below 1 at the moment. So the thing seems to be in control, and there is an enormous pressure in all the countries at the moment to really relax the measures, but we're not sure exactly what measures to be relaxed because of the economic consequences, as you can imagine. So there's an enormous public discussion. Also, like in a country in the Netherlands where we have been in lockdown for 5 weeks now, there's a lot of pressure to actually open up again. So basically, I think we are coping well with the hospital situation. So it's not in the Netherlands, but in Spain, it is really much more, and also in Italy, much more disastrous. Initially, I said there was kind of a denial measures, especially during the skiing season here, in northern Italy, and also some soccer matches actually taking place there have been the reason that the virus was fanned from there. But a lot of fans going from one country to the other, coming back, and then coming at the time in other countries where it happened to be a carnival at that time. So that was an enormous explosion after that, because it was not appreciated, the early Chinese data actually, that had shown that the virus was already transmitted very early on in the disease and even before. And actually the policy in general in many countries was, if you're not sick, you cannot spread the virus. I think that was initially a mistake. That was made by most of the countries. So the denial at the beginning that we had to take very stringent measures. So the big thing at the moment is how to get out of the lockdown. That's what the discussion is being dominated by at the moment. Getting out of the lockdown means what kind of measures are we going to lift? So are we going to open the shops? Are we going to open the schools again? And again, different countries have different visions there. And there's a lot of political things that we will not be talking about today. But you can imagine there's a lot of difficulties to define the right measures. We are in the middle of that. Perhaps on the other hand, in Europe, there's a lot ongoing. I've been involved in scientific issues like the development of antiviral treatments for instance, with the development of monoclonal antibodies. So they're working on a very promising one with the European project. There's a lot of money from Europe being pumped into the science at the moment at the national level, but also at the European level. And it's academic groups. So we are working on different vaccine approaches. We had, for instance, a big European project that was taking care of Bunya viruses and coronaviruses, and that was dealing with the MERS coronavirus. And on that basis, already candidate vaccines were made for MERS coronavirus, also in the monoclonal antibodies. And these, both these came from a European project that was before the outbreak on coronavirus in general, a multi-country effort there. And one of the antibodies that was raised against the SARS coronavirus actually cross-reacts with the SARS coronavirus too. So there's a lot of efforts ongoing, different strategies for vaccination. Again, the big thing at the moment is, I think, is that what we need to do in Europe is to appreciate that testing is the important thing to do. Testing and tracing and quarantining, and have a smart way to exit the crisis. And one of the major things, of course, that has happened, that the whole social life has broken down, and the acceptance there, in the European countries, in certain countries, the acceptance is great, whereas in the other countries, people start to react against it. So the problem will be that if we are going to relax the measures, that there is, of course, a risk re-emergence of a peak. So we are now in the flat part of the curve as far as hospitalization is concerned, ICU uptake is concerned, and numbers of people who are dying is still a little bit going up. But that obviously is because because it takes some time after ICU or ICU admission. Yeah, that takes a number of weeks, about 4 weeks, yeah, before that actually happens. I think one of the important messages is also that we have to take between the science between the different countries should be taken seriously. Yeah, so all the data that came out of initially out of China and other Asian countries, yeah, were at the very beginning not taken so seriously as they should have been taken, I think, and that has to do probably also with the original experiences in Hong Kong, in China, in several of the Asian countries, Taiwan, Singapore, you name it. They have all been confronted, obviously, with SARS, whereas in the European countries that was much less so. So the reaction in the Asian countries, in those Asian countries, was much faster, and also the maintenance of the measures was much more strict. So we are there with kind of a problem to maintain the measures at the moment, and we have to see how that is going to work out. But so, as a matter of fact, there's a lot happening in containing it at the hospital levels, basically at the ICU levels also, but also people who are being kept in separate premises, not being taken up by hospitals. So in that area, a lot is happening, and I should say there's a lot of scientific work ongoing, similar to in the United States and also in China. I think this is kind of an overview. Thank you very much.
Okay, thank you, Ab, for your very nice presentation talk. And I think although the different nations, different situation, but the Chinese experience for the early testing, early isolation, reporting, and treatment is a key issue to control the COVID-19, to reduce the mortality rate, reduce the spreading of disease. So recently we are talking about the asymptomatic case and the redetectable case. So from the virological side, what do you think? Can you give a simple comments for that situation?
Yes, well, the data we have are very limited still. But when we look at I just talked about the R0, so how the virus is spreading. On the other hand, obviously, what you're asking about asymptomatic asymptomatic infected people or people with very mild symptoms.
Yeah.
And as a matter of fact, when we look at the serological surveys that have been carried out in different European countries now, and the data are emerging, for instance, a country like the Netherlands, which is heavily affected, has been heavily affected, the seroprevalence actually of people, from people who have gone through the COVID-19 or better through the infection in the country as a whole is in the order of about 3%. And 3%, that's for the Netherlands. For Germany, it's not very dissimilar. So I think that is more or less the general thing. So I think the issue of subclinical infections is not a very big issue, I think, because most of the people who have antibodies have also been clinically infected. So one of the issues that was discussed also in countries like the Netherlands is that we could go eventually for herd immunity. If you let the virus pass through the country, so that herd immunity would build up. Obviously, with a percentage of 3%, and we have the impression that in countries that were more heavily affected, that the percentage is higher. Yeah, that is, but it will not exceed 15% or so. So basically, if you would have to wait for herd immunity on the basis of the seroprevalence, I think we are facing a long time. So we really, I think, before that time,
Okay.
a vaccine should do the job properly.
Okay. Thank you very much. In the severe and critical case of COVID-19, there's some patients have suddenly goes worse very fast. So it seems that the cytokine storm or inflammatory storm happens. So how to deal with this situation? I hope you can share your experience from China and from American and Holland. Okay.
Well, I think China should go first. They have most of the
Okay.
experience.
Stephen, what's your opinion? What's your comment for the cytokine storm for the COVID-19 case, severe and critical case?
So I think there's been a lot of, how could I say that, the immunologist and the, a lot of issue about the IL-6, and our intensivist actually jumped very early on the quote unquote cytokine storm. I just also want to state, and again, we don't have data on this, and as you remember, there's no such thing as a free lunch. IL-6 can cause bleeding, can cause severe infections down the line. Yeah. And without randomized controlled trials, we can potentially do some harm. The other thing is that not all patients with COVID-19 who have increasing oxygenation experiences is due to unnecessarily the virus. As you have pointed out and others, other things can happen. Pulmonary embolus, you can have other forms of cardiogenic shock or things that don't necessarily require, that just require a good intensive care unit. So not everything is about the virus in these patients. And I think that's another lesson that we've learned. Sure. I do want to pivot though, if I can, because in the United States, and it'll be interesting to hear, we've had vulnerable populations, and it looks like, again, disease, as was intimated, is also associated with zip code, meaning what we call social determinants of health. And as latest data comes out, there's a lot of underlying disease, but there's also a vulnerable populations. And our biggest one, which I'd be curious to hear, is our elderly that are in long-term care facilities. So we have 4,000 of these facilities in the United States. To date, it represents 20% of our total deaths are patients in these facilities. And as you know, they're kind of like cruise ships. And the rates of infection in these small contained areas is immense, and it is creating a lot of consternation. So I don't know if you have that problem in Asia or Europe, but it is certainly a emerging issue in the United States.
Yes, in terms of underlying disease, it's another important issue for the mortality. Is in China, many patients with mortality patients, there's underlying disease, especially hypertension, diabetes, cardiovascular disease. So it seems that the percentage of the hypertension prevalence in all stage, in aged people, is not higher than the regular aged people. But most diet patients have the underlying disease. So how to explain it? It seems that the prevalence of the underlying disease is not higher enough, but for all the most of mortality patients is have this hypertension, diabetes. Do you have an idea for that?
So, in our data, and again, what just came out in the MMWR, just as you stated, although there were reports of quote unquote healthy people who have developed severe disease and died, we think that is the exception. So even the obesity coming out, as you mentioned, prior smoking or vaping, and again, the other issues in terms of underlying disease. The other thing is, as you pointed out earlier, there are people that are not infected that have been affected because other types of medical care, for instance, ongoing chemotherapies or other types of disease management have been affected in the United States. So I'm also curious, this has galvanized us for digital medicine, telehealth, and I'm just curious about your experience in Europe and Asia in terms of how that has taken off.
Yeah, okay, thank you. How about the Law Ann? How about Law Ann? Do you have a comment for that? Or any question or discussion topics?
Yeah, so I wanted to comment on our patient population. We noticed early on that morbid obesity seemed to be a risk factor for death. And even in patients that had no other typical comorbidities that have been characterized as risk factors. So even before the publication started to come out, our early experience was there's something here, because the patients that were dying were so large they didn't even fit in our morgue. So that it struck us before we even had clear data that was an ongoing risk factor. And now I think there's been publications to support that. And we unfortunately have had patients, young patients, without any comorbidities die. And, that from a perspective of trying to keep people's morale up. That's been really, really hard to do. But we've gotten better. I think we are doing a better job in a matter of 3 weeks managing these patients, being much more proactive with proning them early, and keeping them out of the critical intensive care unit. So I think there's been a real shift among our caretakers that we got this now. We feel like we are doing better managing these cases. And our state has been much more proactive with testing, and they have actually had the National Guard go into many of our nursing homes this past week to test our nursing homes and all the employees at the nursing homes in one of the communities that I practice in. And the rates are staggering. There is a lot of disease in the nursing homes and a lot of disease among the healthcare workers in the nursing homes. And they too are challenged by insufficient personal protective equipment, and honestly, lack of training around how to use the personal protective equipment. So this is an ongoing challenge. There's also major concerns now among our homeless population. We are starting to get early indications that our homeless population is increasingly affected by this disease. And that's in the face of having many shelters close. So in the town of Cambridge, the public health department just opened up a large shelter, and there's an area for quarantine, and then there's another site for actual isolation. We fear that in the next week or two, the nursing home situation and the homeless population situation is really going to blossom and probably give us a little second wave.
Okay, thank you. Professor Zhang and Professor Li, do you have a comment on the underlying disease or cytokine storm treatment? Do you have any comment on it?
Professor Li，
你先讲。
你先讲。
Okay.
我先讲，我用中文讲。
Maybe a short comment, because with the time limited.
OK， 我用中文讲吧。我觉得对这个疾病来讲的话，首先呢，它的发病机制我们并不大清楚。换言之，是病毒直接损害的，而病毒引起炎症。
Damage the body and it can increase the inflammation level at the same time. So for the treatment, we think that we have a lot of supportive treatment that's very crucial, but we have 3 main obstacles. First of all, we have to prevent the patient from developing severe disease, especially in the first 1 or 2 weeks. So some of the mild disease, they would have aggravation of the disease. For those with many comorbidities, they have high risk, and this also happens in several young patients. And also the second obstacle is the intubation. We have to very early intubation. If the patient needs oxygen therapy and needs intubation, we have to do that very quickly. And also after 1 week, we have to look out for secondary infection. These are the main obstacles. For these patients, the mechanism, we have to do further investigation of the mechanism. It's still too early to talk about cytokine storm. I don't think corticosteroids should be used, especially in the severe and the critically ill illness. I do not recommend corticosteroid therapy because this virus affects with multiple organisms and systems. If you use the corticosteroids, it would aggravate the disease.
Because this COVID-19 seems that the injury the immune system. There's a CD4, CD8, many immune system can be damaged by the autopsy, biopsy data. So, and from the clinical practice, you can see the lymphocytopenia. And recently there are some findings that many aspects, including NK cells, T cells, B cells dysfunction in the COVID-19 patients. So we have to be awareness that the immune depression or immune compromise may be one of the important issue for the mortality of COVID-19. So, but we're still working on it, I think. Professor Zhang?
等一下，我还有一句，等一下，这个，
Okay.
所以说治疗除了刚才我提到的这个基本治疗、营养支持、养疗之外，对于这些病人
Oxygenation treatment in the early stage, I do recommend that we use some of the treatment in those who are susceptible to the severe disease. I recommend IVIG use in these patients, and also anticoagulation treatment. I think that would be very crucial in the patient, especially IVIG. That would remarkably decrease the mortality in patients. That's my personal opinion. Thank you. Thank you very much. I would like to also speak in Chinese. For severe patients and critically ill patients, the treatment actually, I think, because the viremia in the patients, so it's a viral sepsis. The viremia caused viral sepsis, which would cause some life-threatening events, especially the respiratory failure. So among the severe and critically ill patients, the main reason for mortality is the uncorrected respiratory failure. So I think oxygenation therapy is very crucial. Why is the high mortality? I think the main reason is that the patient cannot be provided with sufficient oxygenation. When we support viral sepsis in the patient, and when we observe a cytokine storm in this patient, we should use some inflammation antagonist, and I think that includes steroids. But steroids can be very limited use in later stage. So among these patients in with critically situations, I do think intubation is very crucial and in necessary times. If the patient has higher level of carbon dioxide, we can use ECMO, but that would not correct the mortality. But how to decrease the mortality? I think the main thing to do is to give the patient early stoppage of the disease, and to prevent the patient from progressing into the severe disease. If the patient has entered the terminal stage of respiratory failure, the success rate of our therapy would decrease. So it's very crucial to prevent the progression.
About that. It's for the mortality of the disease progression, and it's a kind of from the quantity to the quality. It's oxygen oxypnea can cause underlying disease worse. So this is why many patients died of the underlying disease, not only the COVID-19. So I think the MDT group is very important. In our hands, in our experience, in the early stage of the COVID-19, MDT group is very important. So because many patients not died of COVID-19 directly, it's indirectly by the underlying disease. So this is one experience we have. Another thing is the predictor. The predictor, we pick up some predictor for disease progression. Early treatment for with the predictor, including the CRP, interleukin-6, and serum ferritin, troponin, and the lactase and D-dimer. We can see the elevation of this predictor with the disease progression and the death. So I think this is very important. And the last one, I think, for the severe critical case treatment is the ICU care. So be sure that the severe and the critical case can be admitted to the ICU. This is kind of the health system challenge, but we have to do that well. Otherwise, the mortality rate will be increased. So, okay, I think the time is up. So thank you very much. Stephen, and Lois Ann, and Wen Hong, and Taizheng. Thank you for your input. I think we can discuss later to find time. Okay, thank you. Thank you very much.
Bye-bye.
Okay, we'll go to the next panel discussion. Professor Yaolong Chen will chair this session. Yaolong Chen, please.
Thank you, Professor Wang.
Okay, thank you.
Okay, thank you.
Bye bye.
我想问一下，我们胡善莲教授和薛兰教授都已经到位啊，在有摄像头。哎，好，薛教授，我已经看到你了。哎，胡教授，好，我已经看到你们了。好。
Good evening to all of the students and colleagues who are listening to our lecture. Welcome to our second seminar. The topic for this seminar is global solutions to public health priorities. I am Dr. Guiqiang Wang from Lanzhou University. I will be the moderator for this current session. We have 3 guests for this session, including Dr. Hu Shanlian from Fudan University, Dr. Xue Lan from Tsinghua University, and Dr. Janice from Columbia University, who was also notably a ballet dancer, which shows us the importance of multidisciplinary training in career success. You all have the introductions to these guests in your, so I will not go into depth about their introductions.
You have been a ballet dancer before you started your career in healthcare management. 好，我们今天的圆桌论坛呢是有2个部分。首先我会请3位嘉宾各自谈谈在当前和未来的公共卫生领域什么是最重要或最需要优先解决的问题。然后我会请
current public health work and what are the problems that we need to solve first. Next, I will ask our experts to pose some of their potential solutions. Everyone will have 10 minutes, 5 minutes to talk about the challenges and 5 minutes to talk about the solution. I will keep time because we are going a bit over time. If we have time left over, we will choose questions from the audience and ask our experts to answer them. Because we have simultaneous translation, so we would like our Chinese experts to speak in Chinese. First, let's go into the first section. Einstein once said that finding a problem is more important than solving the problem. He also said that if I had 1 hour to save the world, I will use 59 minutes to clarify the question and use 1 minute to solve it. I think you all know the importance of finding the key issue. So first, we're not talking about how to save the world. We're talking about how to solve major public health problems. We know that in this new era, there are new challenges for public health, especially in the COVID-19 epidemic. This has led us to think about the priorities that we need to solve in global public health. I will ask our 3 guests to tell us what they think are the most important public health issues that China and the entire world is facing. So I would like to invite you to tell us what you think is important and why you think it is important. Please welcome Dr. Hu to talk first. Hello, Dr. Chen and all of our guests. I will give some initial thoughts, which will be followed by Dr. Xue and Dr. Janice. I prepared answers to 3 brief questions. The first is how to better manage our public health and improve public health capacity. In the after transmission of COVID-19 in Wuhan, this raised awareness in multiple sectors. First, we must talk about governing the country. In public health, there is also governance. This governance is something that was put forth by the WHO. The WHO says that health systems has 6 blocks, one of which, an important block, is governance, which is how to lead and govern our public health system, how to design strategies and how to implement measures, how to put forth laws to regulate. Currently, during COVID-19 in our country, regardless of if it on the national level or in Wuhan city, compared with other countries, our mortality and morbidity are not the highest, especially our morbidity. Recent mortality numbers have increased to around 5%. In terms of governments, in the early stages, it seems that there have been delays in reportings. There are issues with the direct reporting system. So when we listed the disease as a type B disease that should be managed as a type A disease, this was an important step that I will go into further depth. The second consideration is how to improve international collaboration in public health. Our national leaders are realizing that this is important now because emerging infectious diseases do not discriminate between countries. No infectious disease will only affect one country. So we need more collaboration and we need sharing of data and sharing of experience in fighting this disease. Recently, in testing and there have been great advances in testing across the world, and our country is also researching vaccines. So collaboration and openness in research in these areas is incredibly important. Also, we need to improve research on how to increase public health preparedness. In China, remdesivir trials are underway, and other chloroquine trials are also underway. But at the end, the most effective measure is the vaccine. The last issue is we learned from this outbreak that increasing funding and resource allocation is incredibly important. I saw a story from abroad who said an old man refused ventilation because he asked who was going to pay his bill because he could not afford ventilation. In Shanghai, we had recent news of 2 elderly people, one 62, one 64 years old. They both used ECMO machines that cost up to 130,000 US dollars. So we see how payment is incredibly important in treatment of this disease. It cannot be left up to the individual. So treatment of critically ill patients to decrease mortality and to improve patient lives, this is incredibly important. These are the 3 issues that I wish to raise. Thank you, Dr. Hu. I would like to summarize. First is to improve governance. Second is to improve collaboration. And third is to find funding and more equitably allocate funding. Next, please welcome Dr. Xie.
非常感谢邀请我今天
Thank
这
you
个
for inviting
参加
me
这个研
to
讨会。
attend this
那我
seminar.
想这样，这个我这儿有一张 PPT，
I have
我想
one
把这个 PPT 跟
PowerPoint
大家来分
slide
享，
that I
然后
want
这样
to
的话呢，
share
我想
with
可能
you
会说得更明白一些。另外的话， 我
to
这上面有
further
中英文，
clarify my
这样我
thoughts.
们这个Katrina 这个我想可能会也更容易这个
It will
了
also
解。
be
我来
easier
分享一
for
下屏幕看看哈。
Katerina to see. I will share my screen now.
可以。 不知道大家能不能看到？
Can you see my slide? Yes, I can see your slide.
啊，是吧？我这个其实就是我想我就不把它放成这个什么了，因为我放成那个正式的那个整篇的话，可能有问题。就是我的问题啊，就是应对公共卫生这个危机时主要面临什么样的挑战啊？那我想这个的话呢，其实又可以分成几个方面的问题。然后我想也在简要的评论一下我们这次做的怎么样。首先第一个问题呢，就是风险认知的问题。因为这次这个所谓叫新冠病毒的话呢，它也是一个我们以前没有碰到过的病毒，所以实际上在它这个初起的时候的话呢，我们对它其实也有个认识的过程。所以的话呢，怎么样能够比较快的这个抓住这些前期的信息，然后的话呢，对它进行比较准确的认知。我觉得这个的话呢，是我们面对这类问题的时候呢，这个我想的首先最大的一个挑战。第二个挑战的话呢，是一旦我们掌握到一些它可能带来的风险的之后，我们怎么样做出决策？那么这个决策呢，就是怎么样去权衡利弊啊？就好比说像武汉封城这样的这种决策，那么这个的话呢，可能会带来很大的这种成本啊，不管是从经济社会各方面的成本，所以在这样的情况下，而且呢，你还不知道是吧？这种就是这个病毒它可能带来的这种危险的时候。所以这种利弊权衡其实是具有非常大的挑战的。第三一个的话呢，就是说，在我们应对这类事件的时候，尤其是到突发事件已经发生了以后那么就像实际上在武汉这个情况，就相当于是1月20号以后，我怎么样就是说，把我们的应对行为能够在这个能够提前。就 move ahead of the curve， 这个呢是非常关键的。那你像检测的问题，像当时这个武汉应对这个，在这个20号之后有一段时间那么检测各方面的一些决策的话，好像似乎是总是没有跟上这个疫情的发展，所以这个的话呢，就是这个呢也是一个很大挑战。下面一个问题呢，就怎么样去调动资源满足峰值需求。因为在所有这些突发事件的这个发展过程中的话呢，它都会有一个特定的所谓叫 peak demand 或者是 surge demand。那么怎么样去调动各种资源来满足这种需求？这个的话呢，现在是非常大的挑战。最后的话呢，就是像我们这样一个就是这种全球性的这样的一个大的这种疫情的话呢。那么怎么样去协调各地的政策？这个的话其实也是非常关键的，因为不同地方情况不同。但另外一点的话呢，如果不是大家共同来协调行动的话呢，某一个地方解决了问题，其实这个对总体来讲其实意义不大。所以这些的话呢，就是我们应对公共卫生危机的话呢，所需要解决的一些问题。那么我想的话呢，我不知道有没有时间，我想把下一页的话呢，我就来简单的我用中文来说，就是我们如果对我们这次这个新冠疫情，那么中国目前这个对回答这些问题。
Talk a bit about how China has responded to these questions.
第一个的话呢，就是在我们讲这个怎么样去在风险认知上，我觉得这一点的话呢，我们虽然在这科学研究方面，应该说是非常快的，及时把它这个基因测序完成，但是另外一点对它的这种特点的判断，可以说的话呢，我们还是这个有一些遗憾。第二一个就是在这种面对不确定性的情况下，这个做出决策。那我觉得这一点的话呢，中国政府、中央政府可以说是非常果断的做出了及时果断的做出了决策那这包括武汉封城，包括全国一下的这个启动这样的政策。这个的话呢，我觉得是应该是我觉得这个是非常了不起的，因为当时。在全国很多地方，其实病例是非常有限的，但在这种情况下，中央政府采取的决策，而且在大年初一马上，中央最高决策机构开会成立领导小组，我觉得这一点的话呢，可以说是为中国应对这场 重大的事件的话呢，可以说是赢得了先机。另外一点是在 move ahead of the curve 的话呢，那这一点的话呢，那我们有些方面是做得很对的，就是说包括这个封城，包括这个全国启动，但另外一方面呢，也确实在武汉当地，那么可以看到呢，它又很多的这个具体的措施的话，又有一点滞后，对，这个也还是比较可惜的。那么下面一个的话呢，就是怎么样去这个就是各地方的政策去怎么协调。应该来说的话呢，从我个人感觉，这一次的话呢，还是应该说有非常大的一些进步，跟中国以前的这个相应来比那么很多地方政府根据它各地的情况，那么进行不管是在这个疫情防控的措施，包括在它恢复生产的时间等等，那么都根据各自情况呢来做出一系列的这种努力。最后的话呢，就怎么样能够去这个动员这种能力。那么我觉得的话呢，从这点来看的话呢，在我们武汉应对的这个起初的这个阶段的话呢，还是有一点这个应该说还是没有跟上形势。但最后呢，在全国动员的情况下呢，应该说我们还是把这种需求能够满足。所以这一点的话呢，我觉得对任何一个国家那么即使中国这样大国，就是满足这种峰值需求那么都是一个巨大的挑战。所以这也恰好说明我们全世界各个国家在应对这样的大的这种危机情况下呢，一定要这个共同的合作来共同应对。那好，我就讲到这儿，谢谢。
That is all. Thank you. Thank you, Dr. Xu. Dr. Janice, Dr. Hu and Dr. Xu just gave us a few insights about the present and future of for China, challenges for China in the face of COVID-19, the priority issues that need to be resolved. Can you share what you think the priorities are in the global stage? And if there is time, could you please discuss what issues, which challenges in China that are similar with other countries and which challenges are different?
Yeah, thank you so much first for the invitation. I'm really happy to join this panel. Can you all hear me all right?
Yeah.
Can you hear me okay?
Okay.
Yes.
Yeah, great. Thank you so much. So yeah, as you maybe know, I'm German born and I split my my time between France and the US. So I'm quite involved with many of the political decision makers in many countries. Right now in France, in lockdown still for almost another month. Well, we see the effect. That's the positive news. Maybe just to give you the numbers for France and Germany, which are quite substantial, almost similar now. Germany, more than 142,000 cases confirmed. In France, 148,000 almost. And they were kind of in the beginning, France was quicker accelerating and Germany was slower. And then France went into lockdown. Germany was kind of going a little bit up in the curve. And then so they kind of, you know, went into lockdown pretty much one after the other. And now are getting to a similar stage of cases confirmed, not in terms of deaths. And that's a big question mark because Germany has managed to keep death quite low. And there are, of course, quite a lot of theories about it. It's always interesting from my perspective and as a professor in the health sciences to see how media is interpreting and filtering the numbers and the reasons and the variables that are in the end, you know, the basis for political decision making. If you look at all the rumors, you know, why Germany is kind of maybe successful in terms of having this low death rate, it's interesting. I mean, they say testing, they say, and that's actually one big issue if you look at ICU beds. Germany has by far the largest amount of ICU beds per 100,000 population. So that is, I think, and that was so far a major reason why they could keep it low. And also they started testing very early. They were actually not that early with the lockdown. And I've been trying to push that, working with some of the authorities. It was very hard for them to get to that point to do the actual lockdown. It's a very decentralized country. We have a lot of authority with the different states. It's different in France. It's very centralized. They can just say, now we start this lockdown, and it's kind of done. And in Germany, it was much more difficult to get to that decision point. But getting just quickly back to that low death toll that we see in Germany right now, interesting. Also in comparison to Southern Europe, you know, the numbers in Italy and Spain and also France are quite high, not as high as Spain and Italy, but with 18,000, more than 18,000 actually today in France, it's quite high. The good news is it's flattening, but one major reason also why the south of Europe is so different is that all the cultures, the country cultures are very different. And whereas the Northern Europeans, they have their elderly population much more separate from the actual family. That's also one aspect that is important and not so much discussed, but in Southern Europe, it's much more common to kind of get together every day or at the weekends with the whole family. And that's also one reason why a lot of infections happened in the elderly population. And you cannot really compare. That's one big aspect, the population that was infected in Germany with that was infected in Italy. Yeah? You saw many more severe cases also because the demographics of that population was and is just different, and that is going back to cultural differences, which are not really in the spotlight, but are an important factor. How do people socialize? How do they come together? Because proximity is one of the major issues in the infection process. And if you have cultures that are more close, you will see obviously more quicker infections and also more elderly and severe cases. But who else is not in the spotlight? And we should talk about public health here and public health priorities. And that was actually my first thought when you asked me to elaborate on the issue. I think this is really kind of the prime time for public health now, and public health has never been in the spotlight. It is kind of the stepchild of health sciences, and now suddenly everybody is looking at public health to find a remedy, but there is none except for if we get at some point a vaccine. There was this discussion about herd immunity in many European countries. Well, if you really look at the statistics and the death toll that would have been involved with such a strategy, it's probably, or it's definitely, also an ethical question that you cannot just say, hey, let's pursue this strategy and not take care as a country of our vulnerable population. So most countries did not do it. Followed a certain strategy of lockdown. And now the question is, of course, how do we live with the virus? How are we going to do that in the next couple of months, at least? So I've been working with a lot of these political leaders in many European countries, a big issue. And I think that's important also to keep in mind when you look from China to Europe, and how certain strategies, how we could learn, how the same strategies could be implemented. Well, for the European countries, and I would say there were two phases. The first is recognizing the issue, what's actually happening, the severity of this pandemic. It took them long, and then of course this cultural background of in most European countries, you cannot just easily communicate a lockdown. It's against their understanding, against their culture. So it was a longer process until we got to the point that this was actually a message they had to give the population. So that's why they were quite late. I can tell you mid-March, March 15, they were still partying in Paris as if there was nothing going on. And 2 days later, they were in lockdown. And that was, how quickly it then happened once they they realized it, and they actually realized also they had to communicate that. So it's really hard to make these prescriptive decisions in European countries. And of course, as it was mentioned earlier, it's not one Europe. Each country has kind of taken different steps. Nevertheless, the bigger countries are kind of trying to coordinate these steps. So there is now this phase 2. What's coming afterwards? Germany is going out of lockdown, and it actually was a much less strict lockdown than in France. France is really strict, but in Germany they were still allowed to do quite a few things without permission. But what are they going to do afterwards? And Germany is going out of lockdown already on May 3rd, and France on May 11th. So distancing, social distancing is of course a big issue. And then combining that with the economic considerations, who is going to open first? Now in Germany, they start with the small shops instead of the bigger shops. They want to, of course, those maybe are more vulnerable. But it's always, you have to find reasons for your political decisions, and it's just not easy. In France, it will take longer. Of course, restaurants, hotels, that's not even on the radar screen when that will open again. But I'd like to get back quickly to that cultural aspect. So tracing is a big discussion in France, in Germany, and many other European countries. Again, it's a little bit against this culture that we have. So it's not so easy to do that. Wearing masks would be, or it looks like that's going to be mandatory in many public places after lockdown. But again, it's a prescription, and many European cultures just don't like that. And testing is also, of course, on the rise, and that's important too. So they are building system remedies, and they are trying to educate the population. And interestingly, Germany, for example, is staffing up public health agencies. I just got the protocol from the chancellor.
Can you hear me?
They were discussing. Yes.
Dr. Janice, I'm sorry to interrupt you.
I hear you. Yes.
Give me the very limited time.
Can you hear me?
Yes. Give me the very tight time. Can you hear me?
Yes, I'm last 2 sentences here.
Okay. Please.
I'm wrapping up. So they are investing in public health agencies. They are really working on, also the appreciation of healthcare workers in this pandemic, and in particular nurses. So they are building on these system remedies and on public health education in the public. What about the future? Maybe one last sentence. Will it be more shared? I think we see a lot of solidarity now among individuals. I'm not sure about, also the solidarity among European states. As I said, they are discussing measures, but the question is always, will they bring it to the European level to make it a joint initiative and a joint undertaking? So yeah, that's from Europe. I think most importantly to keep really the differences in the cultures and the histories of the countries into account, because that gives you a good idea why certain learnings from China are, maybe not so easy to implement, and facing different issues, but maybe also facing different opportunities. Thank you.
OK， 好，非常感谢 Janice 博士带给我们的
for sharing. When I was listening to her talk, she mentioned the fact that the public health was never in the spotlight as much as it is right now. This reminded me of something I saw earlier. One is that in some provincial level CDCs, they are recruiting a large amount of workers. We will hopefully have more workers in public health. The next one is, I see that some universities are putting their postgraduate education focusing more on health education and public health. Because of time limits, we have an additional 10 minutes from our modulators. We will go on to 8:50. So please let us go on to the next topic. We all mentioned, each of you mentioned 1, 2, 3 top priorities facing public health in the world today. I would like to invite each of you to choose one issue that you think is the most important, or an issue that is most urgent that we see from the current epidemic. What are our potential solutions for this problem? Let's please welcome Dr. Hu to share first. Just now, I want to talk about the first question, that is how to improve public health governance. In the public health field, this is something that we've been talking about. That is how to set up a regulation for public health crisis management. In our infectious disease law, we have specific regulations on how to respond to different diseases, but currently these laws and regulations need to be improved. For example, our infectious disease law, we need to modify it. Recently, we have a wildlife protection law that has been recently put out. We see people saying on the internet who are saying that we need regulations on how to, we need a regulation on how to conduct emergency response and management. Another higher issue that we need to think about is biosafety. Although we currently have a basic healthcare education law, this is not enough for our public health preparedness and governance issue. Second, in such a major crisis, prevention is not enough. We need prevention and education, and we need to guard against rumors when we are sharing information. So this is a comprehensive issue. We see medical institutions who are conducting sterilization. After the current epidemic, we have a triage mechanism for severe cases. So all of these experiences are experiences that we have accumulated. And in resource allocation, in public health, it's not only about prevention and treatment. In this case was a good case of combining prevention and treatment in management. But an issue we need to be aware of is the supply chain. We need to set up a system for backup supplies for large emergency events. So this is a good chance for us to think comprehensively of how to set up a public health management governance system. Dr. Chen also mentioned how to train more public health workers and improve their capacity. the current workers who have undergone this battle, they have increased their capabilities. Even for the layman, even for our lay population, they have increased awareness. So our public health schools, we have over 100 public health schools across the country. In the future, in training our postgraduate students and training people who are currently already working, this will increase our capability to work field epidemiology. So third, to improve our workforce is an important issue. The fourth issue is how to increase our communities, the capacity of our local community healthcare workers and of village healthcare workers. Currently, it's mostly specialists who are attending treatments in infectious disease specialties or in ICUs. But more importantly, it is how to prevent across the board. Now we need to prevent import of cases and to prevent dissemination of cases within the country. So we need to increase capacity for epidemiologic work to assess risks and to do testing, to do early testing and early reporting and early referrals. So this is why we need to enhance our grassroots efforts. The next one is we need to set up an early warning system, especially a response mechanism to early warnings. In every province in our country, we have assessed the risks of different counties and different provinces. This will help in our efforts. This is important in our efforts to resume work and to continue prevention. It is even more important to set up an early warning system. So, for example, in January of this year, how we could have done better in putting the warning out early. The sixth measure we can use is in terms of data, meant to better predict the disease. Now, based on its basic transmission rates, in China and abroad, people are doing ROI analyses. Our prediction of the epidemic, our analysis of the source of the virus, and sequencing of the virus. All of these are important basic foundational work. So this is the sixth issue that we need to solve. The seventh issue is, in our actual experience, we need to set up a complete system for prevention and research and clinical treatment. These three sectors should work coherently together. We need to set up this kind of mechanism. We currently don't have therapeutics, we don't have vaccines. So in this background, scientific research is incredibly important. Back then, when we had a lot of patients, now we don't have so many patients, so it's more difficult to conduct research. And lastly, I think we need to learn about crisis management lessons from different countries across the world. It's hard to say which country has the best measures because different countries have different healthcare systems. The measures they put out are based on their own their own situation. So we can't recommend other countries to use China's experience, but we can learn from others' experiences. For example, we required wearing masks and social distancing and hand hygiene We also forbade crowd gatherings, but in some different countries put forth different recommendations in these matters. Some countries focused on hand hygiene, some focused on social distancing. This is because there are differences between different countries. So I think it is important to improve communication of experiences in facing public health crises between different countries. This will improve our public health governance capabilities. Thank you. Thank you, Dr. Hu. He mentioned 8 different solutions. Thank you for sharing with us. Next, please welcome Dr. Xue. Dr. Hu said a lot. I don't really have that much to add. In terms of what he already mentioned, I want to talk on 2 points. The first one is in the early stages in risk management, how to better improve risk management. Risk management means to mitigate the risk before it has developed. This is incredibly important. I think this should be done in 3 steps. The first is to recognize the risk, to capture the early warning signs. The second is to understand the risk, to analyze the data that we have acquired. Third step is to predict risk after we have some early data. These 3 steps, if we do them well, then we have a chance of mitigating the risk before it begins. In the first step, we have a direct reporting system, which is important. But apart from this formal method of reporting, can we use informal methods? For example, on social media, we need to pay attention to the early warning signs that appear on social media. And second is in analyzing the risk. I feel that our expert team went to Hubei in 3 ways, and we shared our information through a media report. It shows that our analyzation of the data is not as good as it can be. We need a system to better analyze and draw conclusions from the data. We need a responsible expert group that will go in and find information. People are required by law to disclose information. They need to be able to give their decisions towards the decision makers with the data that they have. Decision makers should take in opinions from the experts based on other considerations, and then to decide whether to alarm the public and how to communicate with the public. If we are able to do this, we will be able to stop such outbreaks before it becomes a big issue. Just now, Katerina also mentioned different governance systems between countries with different cultures. I agree wholeheartedly. In China, different areas in China, when we use the same policy, it has different effects. In terms of prevention policies, they should be divided into two types. The first type is medical or physical regulation, such as washing your hands and wearing masks. This type of, whether or not this type of regulation work, we need to analyze this thoroughly. For example, do I need to wear masks in an open space? Should I wear masks in what size of a crowd should I be wearing masks in? I think analyzing this information will be useful for any country, and also including hand hygiene, etc. This type of regulation should be, it's scientific, or it's based on science. This type of policy should be the same between China or Germany. So we need this kind of information. The second time is what I call social policies, such as locking down the cities or social isolation or self-quarantine. This type of regulation depends on your audience or the cultural or living environment of the people who are living in the local communities. So different policy tools will have different effects implemented in different places. So this type of policy, we need to take into consideration the different aspects of different places. So I think we should increase communication regarding these types of policies. Thank you, Dr. Xu. Dr. Hu gave us a comprehensive discussion. Dr. Xu gave us a deep, thorough discussion of two points, risk assessment and policies. Lastly, let us welcome Dr. Janice to choose one issue that you think is most important and share with us how you think we should solve this issue.
Yeah, thank you so much. I will be very short for the sake of time. While also the others were talking, I mean, right now we are working basically on crisis management. And I think if you ask what is important for the future is moving from that mode to actually building resilience. So being prepared and not living or preparing for a pandemic while you're actually living in it. So we need to be more forward-looking. We also need to stay humble. I think a lot of countries just get too comfortable and maybe too arrogant also, that there will always be unlimited growth and things will not change. And this kind of attitude was, of course, very detrimental to the beginning of the management of this pandemic. And many programs that existed for preparedness were actually stopped. So it's not that there were not these public health programs, but many of them were stopped like 10 years ago because everybody thought this would be going on like ever and we would be fine and living in good circumstances. So at last, I would say sharing knowledge, as the others mentioned as well, is important, but also keeping knowledge. What do I mean with that? If you look around in Europe, we don't have supplies, or we have not enough supplies, but we are also not able anymore to produce them. So it's, the downside of globalization, as much as it's great that we collaborate globally, but if we unlearn how to actually do it, we are in trouble once you have a crisis situation. So I think a more even, let's say, sharing of knowledge, and at the same time keeping the capacities, the capability to do something. If maybe one thing happens in one country and you could replace each other's competencies, that would be very helpful in the mid to long term if we think about future preparedness.
好的，哎呀，时间把握的非常的好，真的，今天
our time limit has reached our time limit. I'm sure we all have learned a lot from this session. We are just on time right now. I have received many interesting questions, but we are unable to discuss them further, unfortunately. But this is also good because we will be looking forward more to our next forum. I have about a short conclusion. We are a quarter in towards 2020, but this several months have been written in the history of mankind. Even though currently globalization is an important tide, there is also anti-globalization. Even though we have not found cures for non-communicable diseases, we have emerging infectious diseases. We see increasing numbers of medical knowledge, but sometimes this is overwhelmed by information on social media. This is the best of times, and this is also the worst of times. We see many patients who are currently affected with COVID-19, and we see also many issues that we need to continue to resolve. But it is the best of times because we see so many medical experts and other experts who are working against the COVID-19 disease. We need to produce and to use higher quality scientific literature which is a weapon in our fight against COVID-19. I want to thank our guests and our hosts. Thank you to all of our attendants who are still learning on the weekends. Thank you very much. Goodbye.
Thank you.
Thank you too. Thank you for sharing. We hope that such seminars will continue. This is only the first one. Thank you, everyone. Good night. We have a satellite conference. If our attendants are interested, you may continue to join us. Let us invite Dr. Wang again.